I'm Tom Henthorne from the University of Colorado, and I will present the work I did with our medical student Azin and my junior colleague Christina Sempio, in which we wish to compare single individual sparse data using a Bayesian approach to the full population pharmacokinetic analysis of 36 individuals presented here at ISAP last year. We did this because clinicians often have a plasma, THC, and metabolite concentration sample, and they wish to use this information to estimate THC consumption or its timing relative to the blood draw for this individual. This was a proof of concept study in which we encoded our population PK model from the NIDA study and refit the sparse data from Boulder, one individual at a time, using SAM2 and its Bayesian component. We hypothesized that there would be a significant correlation between the dose estimates determined individually with those obtained from the full population PK analysis on these 36 individuals. As a reminder, the NIDA study was conducted with NIDA-approved cannabis containing 1.75% and 3.55% THC, in contrast to the Colorado study, which used market cannabis having either 16% or 24% THC. In our cohort of 36 individuals in Colorado, one blood sample was obtained at recruitment, and then about a week later, 3 additional ones were obtained on the study day in the mobile laboratory parked outside the subject's home. One was obtained at baseline, another immediately after returning to the van from their home after smoking, and finally one an hour later. Assumptions for modeling purposes were that each regular user was at steady state, plus the time since last consumption at 10 p.m., or assumed to be 10 p.m., and that the in-home smoking event was a constant rate infusion lasting the amount of time it would take to burn cannabis product weighed for that individual. This is the detailed THC and metabolite model constructed from the very dense data obtained during the phase 1 NIDA study. Here are the individual predicted versus observed concentration correlations from the population PK analysis presented here last year of the 36 Colorado subjects using the NIDA model as a prior. These graphs are the main results from this small study. On the right are the respective estimates for steady-state daily THC consumption using the SAM2 Bayesian approach compared to the population PK analysis. And on the left are the estimates of consumption for the in-home smoking event. Note that while significantly correlated, the SAM2 estimates systematically underestimate doses compared to the population PK estimates. We continue to explore in a proof of concept manner the ability to flip the paradigm of our usual anesthetic drug modeling exercises, in which here the pharmacokinetics are the known or somewhat known values, and the dose and timing of the dose are unknown values that we wish to estimate. We previously demonstrated here at ISAP last year and in publication a high correlation of pharmacokinetically estimated doses to estimates obtained by detailed questionnaire and weight amount consumed, and here show promising work that even with very sparse data from a single individual, we can estimate dose nearly as well as with a population pharmacokinetic analysis with many subjects. Thank you very much.